What do you say to the parents concerned about their children's health, Mr. Secretary?
Be fully compliant between maternity and 18 years.
Because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So, I'm sorry, but this is not what she has said publicly. She has said...
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses. And let me get this straight.
This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her.
Scientific credibility. And now the American Academy of Pediatrics.
Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access.
Provide a study that said that it is effective for healthy kids.
To Senator Cassidy's colleagues' points that they're going to have to go off-label
This is crazy talk.
to prescribe a vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what?
Yeah, I do. I know exactly.
Do you know what an off-label prescription is?
I know exactly how it works.
Senator Barrasso. Thanks, Mr. Chairman. Mr. Secretary, thanks.
We're infusing more than 50% increase in the amount of money that is going to rural communities over the next 5 years. It's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion.